Her pH was 7.13 and PCO2 was 105.
pH was
7.13.
PCO2 was
105.
105. This is day कौन सा था?
Day 1.
Day 1 which day?
Sorry?
The कौन सी तारीख थी?
Sir, ये 5-1.
5/1 मतलब 5th जनवरी को
5th January.
5th जनवरी में PCO2 was abnormally high 105. उसके बाद what is the next ABG?
Then sir, in the next ABG, it further increased to 121.
121.
Yes sir.
121 it is on the same day on the
On
5th.
the same day sir. 3 hours later,
Post 3 hours it went up to 121 with a pH of.
7.09 sir.
So here we will talk about it, Akshat and Naren, that if you see a patient, whatever may be the case, I know it's a advanced lung fibrosis, but if you see the pH 7.09, it's not compatible with life. That means patient is severely acidotic, and this can create any kind of problem. It can go into arrhythmias, patient can go into cardiac arrest and all. And the PCO2 was 121. You can see it's pathologically abnormal. And why pathologically abnormal? Because if you see the PCO2 and the pH, it's not compatible with life. Then what we decided, he said, since we know that she has been progressing as a lung fibrosis, ideally speaking, we should have been put her into an invasive ventilation here. You know, with a predicted alveolar ventilation. But we said no, we'll take chances because we know once these patients are on mechanical ventilation, there are issues. There are complications, tracheal complications, there are ventilatory complications, there are dependency complications, infective complications, and most importantly is lung fibrosis. Possibility of barotrauma is also high in this kind of patient because they're stiff lung. Then what happened next? What did you do?
We continued with the NIV.
NIV. What was the pressures you give in NIV?
PP 12.
Achha, so that means we increase the PEEP because PEEP will improve the alveolar. PEEP will improve the ventilation and oxygenation. And IPAV, how much you give?
20.
20 by 12. Then what is the next ABG?
So the next ABG was PCO2 114.
114. This is same day or next day?
Next day morning sir, 2 a.m.
2 a.m. Okay. And what was the pH?
pH was 7.12 sir.
7.12. Still you see 121 to 104 we didn't gain much. The patient was in a risk zone. It was 7.09, 7.12, there is not much of difference. So we took that chance, these are called these are taking risk. Because severe acidemia and lead to significant arrhythmias and other problems. So you continued in IV, whole of 5th. What time she came in the evening in the 5th?
At around 7:30.
7:30. That means from 7:30 to next morning, we continued and we accepted her pathological 2 a.m. We continue to give her non-invasive. Then what is the next ABG?
Next ABG sir is on 6th at 6:30 a.m.
6:30 a.m. Okay.
Yes, sir.
What was the PCO2?
PCO2 of 79.
This is the gain you got. So that means here if you would have been restless at 2 o'clock in the morning, 6 o'clock, the patient would have been in ventilator and there would have been complications. I say no. Sabar ka phal meetha hota hai. I say no, you keep on doing it. Even if you, because why I took a chance? Because there is a marginal drop. I said let me try it. And what made a difference, we didn't allow the interface to go into leak. We said let it be fixed. We will not feed the patient, we will use total parenteral nutrition, but we continue. This is a remarkable gain, and this is something which is very encouraging, and this is thanks to you people that you have worked very hard. And what is the pH here?
pH of sir 7.24.
7.24. That means pH is improving and PCO2 is improving. Now what is the next ABG?
So sir, next ABG is of 6 at 4 p.m.
4 p.m. That means almost 24 hours. Yes. What was the PCO2 that time?
Sir, PCO2 again increased to 93 sir.
So that means here, and what was the pH?
7.23.
No, here probably we have faulted, maybe there is a leak, maybe patient refused the ventilation, maybe whatever. But this
Patient
means
became a little
apprehensive and restless because they feel claustrophobic with all those. I know there's a limitation on non-invasive ventilation, but we continued in the same setting of 20 by 12.
Yes.
Then what happened next?
And sir, the next is at 10 p.m.
10 p.m. 6th.
6th, sir, same day, 10 p.m. Sir, her pH improved to 7.27.
This is remarkable. 7 point. Almost we are coming to 7.35.
Yes.
And what was the PCO2?
PCO2 of 74, sir.
This is remarkable. So that means from 79. Here you started gaining it. You know what made it? It's not only your non-invasive ventilation helped here. There's so many things. You motivated the patient. You didn't allow the mask going to leak. You have given a good EPAP and IPAP. And the most important, you were taking care of the nutrition through TPN, if I'm right?
Yes.
Then what happened?
So, sir, today morning, her pH is 7.34 with PCO2 of 57 and PO2 of 75, sir.
So that is remarkable. That means you started on practically 7.13 to 709, and within 48 hours you could bring down to a normal pH. Because what happens, BiPAP works on, resetting the pH of the brain. So that means we have improved her drive, give rest to the muscles, and that is what we are getting this. Always you remember, settling PCO is a sign of a good alveolar ventilation. That means we could improve her alveolar ventilation, we could rest her muscles, and that is how she can stabilize her pH. This is very remarkable. Now, what is the further course of action? The further course of action is that I know this kind of non-invasive ventilation is still claustrophobic. Whenever you get this kind of readings, take the advantage of feeding her something, because enterally it also will prevent sepsis, as you rightly said. So take the advantage, give her something liquid or some blenderized diet so that she can give it for 2 hours. Immediately don't connect to the BiPAP, so she might do a little reflux. So always take the advantage whenever you get in 50s or 60s of PCO2, try to feed her. And rest will continue, and also since we gave in high dose of steroids, reduce the steroids, because steroid also will cause a myopathy, so you start reducing hydrocodone to 50%, maybe 50 milligram twice a day. And rest of the things will continue. Also see to it that if you can improve her hemoglobin, I think the next time we will probably give some Paxils. It was 8.9, try to bring it for 12. So after the TPN is done, probably we can give her 2 Paxils for 2 transfusions, because once you improve the hemoglobin, oxygen carrying capacity also increases. OTC curve also improve. माता जी आपको काफी अच्छा हुआ है. अभी हम आपके बड़े खाना लाना, ये मैं खोल देते हैं हम आपको, ठीक है? कुछ नहीं, अभी खोल देते हैं. मिस्टर, ये बंद करना वेंटिलेटर. जीप दिखाइए, जीप दिखाइए, नाम बताइए. एक गिलास पानी देना, वहां से पानी देना. सिस्टर, इनको जूस पिलाओ, पानी पिलाओ, दूध पिलाओ, जो पिला सकते हैं. ये लो गिलास. नहीं, इसको पकड़ो, आप खुद अपने हाथ से पकड़ो.
दूसरा थोड़ा गुनगुना पानी दीजिए इनको.
साफ पानी दो इनको. कुछ भी ला दो सिस्टर, थोड़ा सा कुछ भी ला दो. एक ग्लास ऑफ मिल्क और एक ग्लास ऑफ जूस, व्हाटएवर. अभी हम पिलाते हैं आपको. अभी आपको हम खाना वाना खिलाएं. So Abhi, the first thing is that whenever you find the PCO2 improving, the first thing you will do is that feed. Intro feed करोगे तो circulation improve होगी, sepsis कम हो जाएगा, translocation of bacteria कम हो जाएंगे. So you have to do enteral feeding is very important as you rightly said. तो स्टीपेन भी दो, तो उसमें मायोपैथी भी कम होगी, सब कुछ improve होगा, मोटिवेशन. सीधा बैठिए आप. कैसे रहती है? पूरा नाम बताइए, ऊंचा बोलिए. ठीक है. नो होर्सनेस ऑफ वॉइस. आप बोलिए एक बार. थोड़ा गार्गल करवाओ इनको बीटाडीन से. दे दो. ये क्या है?
बोल रहे हैं
लेमन जूस. ये पूरा एकदम ढक करके पी लो. पियो. जीभ बाहर खींचना पड़ेगा. So this is what you have made, that you could made her feed energy, and why you could feed her, because of carbon dioxide has come down. ठीक है, बहुत अच्छा हो गया. ठीक है, तो we'll continue the same treatment. हाँ ठीक है, आज शाम तक आपको भेज देंगे. ये कौन है? पहले बंद कर दो सर. हर एक के नाम तो बताओ पहले. नाम बताओ, बेटी के नाम ही तो